By allowing people to be creative, to be innovative, we will redefine what's possible in healthcare. Otherwise, we have to accept mediocrity as the outcome. So what we're seeing over the last few years, certainly after COVID, are exponential technologies that are really changing the way we look after our patients and also improve the outcomes. We're in this area of the P4, which is personalized, preventive, predictive, and participatory healthcare, allowing patients to be the forefront of healthcare. So these technologies are reshaping the way we imagine how a patient interaction might be carried out, but also the whole process and the journey of the patient in the community setting and also the hospital. And the aim, of course, is to use these technologies like big data, AI, machine learning, wearable technology and sensors for remote monitoring purposes, the technologies like AR and VR to allow more therapies to be given to patients, and also things like nanobiotechnology to change the way we design new drugs, medications using AI and machine learning. The whole concept of healthcare is changing and evolving to allow us to really make healthcare more accessible and more affordable. Over the last decade, we've seen augmented virtual reality transform healthcare and also education, both medical and surgical. For example, we're seeing augmented reality smart glasses being used to train people remotely across the world. We're seeing virtual reality being used for therapy for patients, as well as providing education for medical students and for postgraduate training doctors around the world. What it's allowing to do is to allow people to perform a surgical operation, i.e. a simulation, using CGI animation and interactive tools. We're now seeing things like AI chatbots and ChatGPT being used with avatars in the virtual environment to allow better conversation, to allow more communication and training in that area. So what we're seeing is a plethora of technologies in extended reality, AR, VR, and MR, all being used concurrently to transform medical education from the merest medical student to the consultant at the top of his profession. So I think organizations, particularly healthcare, need to be quite wary of being disruptive. They don't want to have the Kodak moment, where if they don't disrupt enough themselves, then the term will be disrupted. So we need to think about how do you introduce innovation, technologies to ensure that the workforce is working efficiently and smartly. In the NHS, of course, and the healthcare system around the world, we're seeing a shortage of doctors and nurses, and we need to build a smarter workforce, number one. Secondly, we know that, for example, healthcare resources are finite, they're reduced, and we have a population that's more older and with more chronic diseases and with less resource spent on them. So we have to think about how organization uses the same resource in a smarter way, providing healthcare that's more affordable. And I think what we have to do is just disrupt ourselves to rethink the model of healthcare, which is fundamentally broken in many parts of the world, and see how can we change using technology as an interface to improve the outcome for our patients. Innovation has to be at the heart of every organization, including a health system. If we do not wish to be mediocre throughout our careers or through a lifetime, then we need to think about innovation. My view is that we need to bring the culture of innovation into the very heart of an institution, allowing everybody to innovate, everybody to have time in their work to think about how do we disrupt and innovate our own work, or indeed for a healthcare system. By allowing people to be creative, to be innovative, we will redefine what's possible in healthcare. Otherwise, we have to accept mediocrity as the outcome. And the question I ask is, do we wish to be mediocre? Or do we wish to be world class and constantly evolving our healthcare to the demands of patients in the future? I've been fortunate to spend a lot of my time over the last 20 years working in conflict zones and low resource settings. I've learnt the use of frugal innovation, how to innovate in a resource low setting to a large population. I've also seen how technology enables barriers to be broken down, the geopolitical barriers that we create ourselves as a society to allow patients in those areas to access healthcare. It's almost taking away the bricks and mortar, taking away the barriers, understanding how do we get care to people who need it most. And I think technology has been the solution for a lot of these problems. We've seen countries around the world who may not have the most first-class healthcare system, but they are leapfrogging other parts of society by thinking differently and outside the box, using smartphones, using a simple text messaging, or indeed technology like AI to allow them to reshape what's possible in healthcare. So I think technology, and AI in particular, has certainly allowed us to disrupt and democratize healthcare around the world. In the last few years, we've seen artificial intelligence become much more mainstream. In fact, in the last year, with the introduction of ChatGPT and the large language models, it's almost revolutionizing healthcare as we know it. The future is actually going to change considerably. We're now going to be using chatbots and AI interfaces as the first point of contact between a doctor and patient to allow better triage, for example. We're then using AI for diagnostic purposes to allow you to diagnose on a chest X-ray or CT scan very quickly for a patient. We're also seeing navigation using CT MRIs to allow you to either perform a surgical operation or indeed navigate through a biopsy or indeed through a headset, allowing you to reshape and look at a 3D model of, for example, anatomy. So AI has certainly been very much part and parcel of who we are at the moment and will aim and disrupt healthcare going forward. We've seen, of course, AI produce its third drug using AI and deep machine learning. We're seeing patients with diabetes have better outcomes by predicting their disease on a retinal scan, looking at, for example, retinopathy, disease of the back of the eye. We're seeing patients with dermatological conditions being diagnosed remotely using a smartphone, using AI. Also using ultrasound remotely. That doesn't require a trained sonographer, but anybody now can put a scan onto somebody's body and be able to diagnose. But what this allows us to do is to automate healthcare, make it more accessible. So the question always is asked, will AI replace doctors? Of course not. AI will support, augment doctors, improve automation, improve the flow, improve the efficiency and accuracy of the diagnosis, allowing doctors ultimately to be more human and spend more time with their patients.